We are counting down to when Bola Tinubu will take over mantle of leadership and what he must do differently where Nigeria's health sector is concerned. I'm joined now by Professor of Virology and former Vice Chancellor of Redeemers University, Oyewole Tomori. Thank you, Prof, for joining us on the countdown. Let's begin with the budgetary allocation to the health sector in Nigeria. 22 years after heads of state of African Union countries met in Abuja, committing to prioritize the health sector by allocating at least 15% of the annual budget to the sector. We're still in between 4 to 5% in Nigeria. What do you think is the problem?
Thank you very much. I think we have a series of governments that have not really cared much about health of the people. It's point blank that, like you said, it was in Abuja they decided they were going to put 15%. We've never even reached 1/3 of that all these years. I think it's a reflection on a government that cares very little about the health of its people. Simple.
But government also has an explanation. In 2020, for instance, the permanent secretary of the Federal Ministry of Health, Abdulaziz Abdullahi, was quoted to have said that the 15% budget for health is an aspiration and a set target that the country wishes to attain. And according to him, it is dependent on a number of factors. For instance, the competing interests from different sectors like education, agriculture, security, among others. And this means the government must prioritize based on available resources. Prof, do you agree that this 15% allocation can't be made independent of other economic indices and available resources?
Well, one important thing you said is an aspiration. So you aim to achieve it. But when you're not even making efforts to go to it, then, I mean, what is the aspiration for? If you make up your mind, I'm going to do this, and you never even attain 1/3 of that, it means you're not serious about your aspiration. That's number one. And I hear people talk about competing interests, and they say Greek and that. The greatest competing interest we have in Nigeria is not all those things. It's corruption. It's self-interest. Even the little that is allocated, how much of it gets into the health? It goes into people's pockets. So when we are talking about competing interests, we should be careful. The major competing interest for our problem in Nigeria is corruption, and not all those things we're talking about. Let's resolve that, and we'll probably have some substantial amount of money, ready for whatever it is we plan to do. Go and check your records. What illegally leaves Africa is 10 times more than what the age that we get. So we are begging our leaders, if they can only just steal 80% and leave the 20% for us, you see a difference in the life of our people.
Corruption is a big topic to tackle. What exactly are you recommending that the incoming administration do differently in this regard?
Accountability and transparency. That simple and simple. Corruption starts with the individual. I use the word self-interest, over national interest. If that individual sees his nation and does what he needs to do for his nation, one by one, it is a accommodation of the self-interest that destroys the national interest. If I'm in a position of authority and I misuse the money, the next person does that, the next person does that, then the entire nation is in danger. So it has to start from each and every one of us. I mean, I'm sorry to be that blunt, but the actual fact, when you look at a man enters the civil service at the age of 25, he leaves at 60. In between that time, he has had 5 presidents, 10 ministers, and things haven't changed. Is it the people who are leaving that are causing the problem, or the people who are remaining? I'm not blaming all civil servants, but the majority of the problem we have in this country, until we face those things, are those civil servants.
The challenges, we've been talking about this for years, so I'm looking at how much impact it will have. Are you looking forward to a situation where, if corruption is dealt with, the number of resources will increase and they will have money to share that will impact positively on the health sector?
Let me tell you, corruption is not, Nigeria is not really a country that have corruption. Every country, I mean, US, UK, whatever. But the people are very sensitive about their corruption. They think a little about, the people they are serving. Here, you find the people that is only themselves they think of. And that's where we are today.
All right, let's talk about brain drain in Nigeria's health sector. And, the reality here is perhaps why we see many of our health workers leaving the country in drove. We hear that as of 2020, close to 4,000 Nigeria-trained doctors are licensed to practice medicine in the U.S. In March this year, the figure has risen to 11,000 in the United Kingdom. What's happening? What are the direct implications also on the sector in Nigeria?
With a continued brain drain, our health sector will continue to drain into nonsense. That's what is going to happen. And when we talk about brain drain, let me say one thing. The basic issue about draining is the environment in which we practice our health. Create an enabling environment for people, and they will stay. Let me give a good example. My generation, we never left, not because we didn't want to leave, but the enabling environment in Nigeria was so good that people like us and my generation stayed. We developed, we served in our country. We had fulfillment of our professional self-fulfillment, and we were able to live a decent life. And so you stay. That's the basic thing. All these people who are going out, you think they are going out because they love those countries. Go and see what they are suffering over there. It is because the environment they're working is not enabling them to function well. That's all. Improve the enabling environment. Those in the diaspora will come back.
On a light note, Prof, you said your generation never left, but you're speaking with me from Atlanta. I hope you have not jacked by yourself.
Hey, Nick, I just came here to see my grandchildren. If my children were in Nigeria, you think I will come to Atlanta? What am I going to do in Atlanta? Well, what am I going to do here? Because the country didn't enable my children and grandchildren to stay in Nigeria, that's why I'm here. For me.
That's reassuring. So let's talk about the implication of this. They say that Nigeria needs to produce about 12,000 doctors annually to be able to meet the required number of physicians. But according to the president of the Medical and Dental Consultants Association of Nigeria, Dr. Oyewole, he's saying that 9 out of every 10 medical and dental consultants with less than 5 years of experience plan to leave the country for greener pastures. Just last year, 7,200 Nigerian nurses were registered with the Nursing and Midwifery Council, Britain's professional body. We're hearing that our country is only, thought to Philippines and India, with more nurses in Britain. What do you think is the role of the level of patriotism that you have talked about in your generation that is not found this time?
There is a limit to patriotism. Let me be frank with you. People quote John Kennedy. They said, do not ask what your country can do for you and or whatever that thing. Before John Kennedy said that, his country has already done something for him. Go and find out his life history. When he was caught by the enemy, his country went out to pick him and to save him. That is what the first starting point. Your country must do something for you before you begin to do something for the country. A country that has not done anything for you, it's not existing. And that's the situation that we're having in the country. First of all, that country must do its own duty. It's a reciprocal thing. It's not a one-way thing. And we are talking about the training. Yes, the more we train, but the more that go out because we allow them to go out, because we make our country so unconducive for them to go out, we can train more and more. The balance is how many remain. And if you don't improve that environment at home, you can train thousands, but 2,000 will go.
I'm wondering what you...
the whole environment, and then we can have no problem with that. People will still live, but the balance that we live with, they're not for our needs.
I get you, Prof, but I'm wondering what you think about the culpability of these other countries, because Nigeria, for instance, has been on the WHO list of countries with a shortage of healthcare workers since 2020. And, foreign employers are discouraged from recruiting nurses from the list, of course, two-thirds of which are in Africa. So you're wondering, if there are no places to go, are we not going to be first to fix the situation back at home? Don't you think countries like the UK is culpable in this regard?
Let's stop blaming people outside for our problems. Our problem has been there from time immemorial. We have not created the environment. They're living and they're living because the situation has continued to be bad. Those people, you can stop them. They will find other places to go. You don't have to go to Britain or other things. There are the other countries that will take them. All these things we're talking about. Why are you asking for culpability of India or Britain when you are not taking care of your own people? No, the first thing is take care of your people. When people go across the Sahara Desert and go and drown in the Mediterranean Sea, whom are you blaming? If the situation is so bad for them to go through those things, do you think you should be looking at is back home, those things at home that is making people to risk their life to cross the desert and go and drown in the Mediterranean Sea? Something must be wrong with your situation at home. Repair that first before you start blaming other people.
You're saying that we must look inwards to solve our problems before blaming
Exactly.
outsiders.